Today's guest is Arms Bumanlag, the Director of Communication and Public Relations at Erie Shores Healthcare. Welcome, Arms.
Robert, absolute pleasure to be with you. Thanks for making some time for me.
Oh, no problem. Thank you. How are you and your family doing during this pandemic?
It's been a challenge. You know, I've been in this role at Erie Shores Healthcare for about a year, and certainly moving from a media background into communications and PR for a larger organization, it's been a challenge. My son is immunocompromised. So when COVID-19 erupted here locally, there was certainly a lot of fear for my family, for myself, my son, and my wife, just the three of us. So fortunately, I've been able to pivot and minimize the risk, bringing COVID into our home. So I've been able to work from home. We've sort of migrated out of that. I'm back at the hospital a couple days a week now, assisting our senior leadership team. But for my family, it's been certainly an experience, and it's been one that I think my wife and I are going to remember for quite some time. And I think the one person who's benefiting from all of this is my son, Liam. He gets to see his dad a little bit more. I'm home a little bit more. And to him, the only downside of this pandemic, bless his heart, coming up on about 2.5 years old, is he's not able to see his grandma and grandpa anymore. So we've been doing a lot of virtual visits with them. It's not the same, but he's doing okay. So for our family, I think like other families here in Windsor, Essex, it's been a challenge. With my wife, she just started back as a pharmacy technician about a month before COVID erupted here locally. And she was getting back into the groove of working again after having our son. And, when this again erupted, she had to make the decision to stay home and self-isolate with my son. So it's unprecedented times. That term continues to be in the media, and it's Robert, you know it, I think, with the team at YourTV, it's changed the way I think everybody's done things across Windsor, Essex.
No question about that. That's why I'm on TV.
And you're doing awesome. I watch the updates. I think they're fantastic. I think you're doing a great job.
Well, thanks. I appreciate that. With the recent departure of CEO Janice Dawson there at Erie Shores Healthcare, what are the plans for a replacement?
Well, we are, again, so incredibly sad to see Janice go. She was instrumental in the growth of Erie Shores over the last 3 years, obviously connecting to the community and doing some extensive work with our catchment area, who's coming to Erie Shores, our emergency volume wait times. Those were down over the last year and a half as well, with Janice at the helm. So I speak from everybody, from our frontline staff right up to our senior leadership team, that we are incredibly grateful to Janice and everything she's done. I can tell you that our board of directors is looking for the next CEO of Erie Shores Healthcare. They are going to be launching a nationwide search to find a CEO to help continue that growth, that community involvement, to continue to advocate for the need of a community hospital for all of Essex County. And it is going to be very interesting over the next little bit to see what I'm sure is the many qualified candidates come to the forefront. So that's where we stand now. We're going to continue to look for a CEO, and we hope to have somebody in place by the fall of this year.
COVID-19 has been here for over 3 months now. How has Erie Shores Healthcare adapted their operations and also their visitor policy?
That's a great question, Robert. And I really mean this from a communications and certainly from a public relations standpoint, is things are changing minute by minute. Certainly when this all started to unravel in March, I can tell you that the days that our management team and our senior team have put in have been, I would say, anywhere between 16 to 18 hours a day. There were a lot of moving parts. There were and there still is, a lot of questions on how we can deliver our services, what we're going to be pivoting. What we saw in Europe, what we saw in Asia, ahead of this really making landfall in North America, specifically in Windsor, Essex. So there was a gradual and I would say even abrupt pivot for us as we rounded out the month of March into April to sort of say, how are we going to deal with the influx of patients with COVID-19? What is our role? So I am proud to say that our staff have pivoted the change in the hospital being here for about a year, I can't tell you about how much physical change has happened here to the hospital. At one point, we had our general surgery clinic area that was shut down, revamped, and repurposed as a second intensive care unit within a matter of 48 hours. This is when we were expecting to see quite a bit of patient volumes with COVID-19, and it was incredible to see not only the coordination but the effort of our staff and certainly our community as well. So as we are slowly starting to see those restrictions lifted right across Essex County, a lot of businesses reopening, we're doing the same thing at Erie Shores. We're taking a methodical and slow approach to surgeries and procedures here within the organization. That's really a multifaceted approach to how we deliver care. Not discounting, Robert, that COVID-19 is gone. Certainly, last month we got the okay from the ministry to open up an assessment center here at Erie Shores, which is in our ambulatory care clinic. That was welcomed, that was needed. We continue to see some huge volumes in that for Essex County, but we can talk about that in the next couple of minutes. But we want to make sure that whatever we're doing it with the best interests of the patients and our communities in mind, because COVID isn't going anywhere. COVID is here, and we need to adjust how we deliver healthcare to the community at large. So that means physical distancing signage. That means taking a look at how we do procedures, how we bring in diagnostic imaging patients into our hospital. Over the last week, I've been working with our senior leadership team to really flesh out a plan on what that looks like and how we bring people into our organization to get those procedures done, to get those diagnostic imaging done. How do we do it safely? So I can tell you that we're continuing to work on that, and that is one of our major priorities over the next few days as we round out this week.
How busy has the testing and assessment center been?
It's been very busy. We opened up about a month ago, and we saw on average about 50 to 60 people a day. I would say in the last week and a half, we're over 100 people a day. It's going to be interesting, again, to see where the assessment center goes, especially with, Premier Ford saying that everybody who wants a test can get a test. They should get a test. We've been seeing all aspects of our community come to the assessment center to get swabbed. And it's been really, I would say the word is inspiring to see our staff pivot and get that up and running within the last month. So I think yesterday we saw about 105 people come through the assessment center. I know that you had mentioned at the opening up of this broadcast that EMS is doing the drive-through testing, which we're happy to partner with them too. So our numbers have dipped just a bit because that testing is now really going to where people are as opposed to coming to a destination. But we suspect as this continues that the assessment center will continue to see a steady increase of volumes over the next several weeks.
How are you dealing with the large migrant worker population in Leamington?
That is a great question. Erie Shores at this point has continued to advocate and encourage the migrant worker population, working with several greenhouses in the area, the consulate here in Leamington, certainly our friend Mayor Hilda McDonald, who's been instrumental too, to get that education piece out. This past weekend, there was the unfortunate death of a younger migrant worker who had tested positive for COVID-19. So we quickly mobilized, I would say Saturday night into Sunday after we had received word that this particular individual passed away and who was in self-isolation as well. Between Erie Shores Healthcare and our friends over at Essex-Windsor EMS, Bruce Crowder and his team, along with Dr. Ahmed and Public Health, we've decided to develop these teams that are really on the ground floor going into where the migrant workers are, where these individuals are, into the greenhouses, into their lodging, and providing point-of-care assessments. Now, up until this point, Public Health was really the point of contact for migrant workers who were self-isolating. They would do telephone calls as sort of a virtual assessment for these folks who were self-isolating. With these teams that, and I can tell you, Robert, just before this Skype interview, I was just out on the ground floor with about 6 or 7 of our nurses heading out to several of the locations this morning along with EMS. Loading up their gear into several buses to get to these locations. But what this allows for Erie Shores to do is to take a proactive approach and say, we're going to go out to these communities, we're going to engage with them one-on-one, and we're going to do a visual point of care assessment on these individuals to say, what's going on, how can we help, and if needed, escalate their health concerns and health issues to a higher level of care. I can tell you this all moved quickly over the last 24 hours. We assembled a team extremely quickly. We were able to get into one location yesterday. Based on the individuals that our team saw, we were able to escalate 3 individuals who needed immediate attention to a higher level of care. So we are expecting this to continue to happen over the next little bit. And I'm expecting to go out actually with the team and video some of the process and talk to some of the staff members who are talking to the population, the migrant worker population, about COVID-19 and assessing them face-to-face in the next few days as well. Something we're very proud of, something that we want to continue to represent for these vulnerable communities in our region, is really getting on the front lines and getting them the care that they need as soon as possible.
Terrific. We're getting near the end, but tell us about your emergency department and concerns with the community maybe not wanting to come in when maybe they have symptoms, not necessarily COVID-19, but other health issues that they should be coming in for.
It's another great question, Robert. We have talked to several of our physicians in the emergency department when COVID-19 broke, and there seems to be this stigma in the community that people may be afraid to come into the hospital for any non-COVID related issues. We are quickly trying to educate the public that if you are in need of medical assistance, please, by all means, come into our emergency department. Really, we believe it's one of the cleanest places you can be during a pandemic. We go through several protocols to make sure that the emergency department and our staff are well trained. And don't hesitate to reach out to our emergency department or any healthcare provider's emergency department right across the region to get what you need done, especially if it's of urgent care. We've seen our volumes really dip in the emergency department, and I think we're not alone in that right across the region. And we're hoping to rectify that. And we're starting to see that. I was down in the emergency department today talking to some of the staff this morning, and it was fairly busy for a Tuesday morning. So we're hoping that people continue to trust us and continue to come in and utilize the services that are here.
Well, I always like to end my interview with a bit of hope. What are you looking forward to once the pandemic is over? I miss family. I miss friends. We've, again, been very self-isolating with my wife and my son. I know my son misses his extended family tremendously, so I'm looking forward to, having family over, really spending that time with family. I looked at this whole pandemic, and I don't want to say opportunity, it's not the right word, but it's sort of a reset for a lot of people. We're looking forward to really connect with our family and make those connections and really focus on what matters. So I don't know if it'll ever be, quote unquote, normal again. I think we're going to have to adjust what normal is. But I think if everybody is continuing to focus on what really matters, people, individuals, caring, compassion, kindness, that's the one thing I don't want to see go back to normal when this is over. I want people to continue to be kind to each other and people to really focus in on what matters in their lives. So I'm just looking forward to maybe just getting a bite to eat at a restaurant. On that note, that's the one thing I would like to do. Well, Arms, really appreciate your time today. Please thank all the doctors, nurses, and staff over at Erie Shores Healthcare. We really appreciate everything that everyone's doing there in some very difficult times. So please say thanks to the staff, and please stay safe and stay well.
Hey, Robert, I just wanted to say thank you to you and your entire crew at YourTV for providing this vital service. I maintain that local community connections matter, and what you folks are doing at YourTV is essentially crucial to Essex County. I know we watch the updates out here at Erie Shores, so thank you, Robert.
Thanks, Arms. That was Arms Bumanlag, Director of Communications and Public Relations at Erie Shores Healthcare.